Thank you, Madam Chair. My questions are for Dr. Delphin Rittman. Last Congress, Senator Markey and I introduced two pieces of legislation. One called the Label Opioids Act requires prescription opioids to contain a warning label specifying that opioids may cause dependence, addiction, and overdose. The Safer Prescribing of Controlled Substances Act would enforce new training regimens upon practitioners that would incorporate best practices on how to prescribe the pain medications. HHS would prescribe these requirements in both of these acts. I think my question would be, in taking legislation like that, and how do you view getting coordination between agencies so that even if ideas like this don't get incorporated in the law, that we do a better job of using the tools that we can administratively to do common sense things like proper labeling and practices that you'd want practitioners to use in a kind of an elusive area that we've had marginal results with.
Yeah. Thank you for that question, Senator, and for your work and advocacy in this really critical area. We know that looking at prescribing practices is one really key strategy for helping to address the overdose and addiction rates that we are seeing, substance use rates that we are seeing. And so I appreciate your work there. Should I be confirmed, you mentioned the piece around collaboration. As a clinical community psychologist, I love working from that space, bringing groups together that are connected to or that touch an issue to think creatively around how we can come up with strategies that make a difference. So I would welcome that opportunity within HHS. There is an internal HHS Behavioral Health Coordinating Council. That's certainly one space where some of this work could be done, but also would look forward to bringing together states. As a commissioner, I've so appreciated the times when SAMHSA brought the commissioners together to have conversations, and we often say that we love sort of bootlegging from each other, and we love sort of taking the best practices that we hear are working in different states, and so I think there are opportunities, should I be confirmed, to bring states together on a regular basis for that state-to-state learning and conversation. But I appreciate, again, your work in this area. Should I be confirmed, would look forward to having follow-up conversations. And do believe that the collaboration across federal agencies, states, as well as community partners is critical here for addressing this challenge.
I think in addition to alerting practitioners and patients of all the pitfalls of using opioids, that there needs to be some emphasis on other methodology, other ways of trying to address chronic pain. Where are you at on trying to be a voice for alternatives in addition to trying to do a better job with what we do with opioids? In other words, new ideas.
Yeah, thank you for that, Senator. So I'm a full believer in the value of using really all that will work. This is such a challenge in terms of the overdose rates we're seeing across the country. I think it's critical that we marshal all tools and resources we know that can make a difference. There is a vast amount of literature on alternative strategies for managing pain. It doesn't always have to be a pill. For some individuals, meditation or Reiki or acupuncture can make a difference in terms of pain management. And so I think it's critical to look at some of those evidence-based practices as well and offer them to individuals to the extent that it fits with their, with their treatment spectrum. But I appreciate that question. It is something in Connecticut that we have put in place. Auricular acupuncture has been shown to help with cravings. It is an emerging evidence-based practice. And so should I be confirmed, would look forward to exploring other strategies, really, for addressing pain management. So thank you for that question.
I think that's important in terms of alternative methods, and then maybe also for pharma to be looking at ways that they need to invest in pain management that doesn't rely on so much emphasis on opioids. So thank you so much.
You're welcome.
Thank you. Senator Baldwin.